So tonight we have Vicky Chapman. Now, Vicky is the support group leader of the long title Endometriosis UK Dundee Support Group. So she's right up in the north of Scotland right now, and she's been working with Endometriosis UK, which is a fabulous charity, for about 2.5 years. And she does a really good job with it. So can we start? Vicky, tell me what exactly is endometriosis?
Okay, so good evening, everyone. I know at least one familiar face here, so that's nice. Hi, Lynn. So yeah, endometriosis is where cells similar to those lining the womb grow elsewhere in the body, and they react in the same way as a period, but they don't have anywhere to escape to. So basically, when you have a period, you obviously bleed. And these cells bleed in the same way, which can then cause inflammation and can cause other issues as well. But I'm sure we'll cover that going forward, unless you want me to talk about symptoms now, but I'm guessing that may be a question you come to.
It was actually my very next question. Yes, so what are the symptoms we can look out for?
Okay, so the ones that most people would experience are painful, heavy or irregular periods, pain during or after intercourse, pelvic pain, pain when urinating, difficulty getting pregnant, painful bowel movements, and fatigue. But that's by no means the whole list that might happen. Endo is a very individual condition, and there's some symptoms that some people might experience and some that others won't. But that's why things like the support groups and stuff are so important, to be like, is it just me who has this? So one of our favorites in the group, shooty bum pain, that seems to be, I can't come on and not say shooty bum pain. So that's that's a favorite in the group of, it's when you feel like you've got knives being stabbed up you. It's not a pleasant sensation, and I'm sure people with endo on the call will agree. So yeah.
I think that's one of the things about it's such a misunderstood condition, because people think, if they've heard of it at all, they think, rather like they associate menopause with hot flushes, they think it's painful periods and that's it.
Yep.
But obviously it's
That
a
is,
whole realm more of different symptoms.
yes, it's very often seen as just being a bad period. But if, passing out at school, not being able to function properly is normal, then, I don't think that is the case. I used to think that was the case, hence why I didn't get diagnosed very quickly. But yeah, I think with endo as well, people just see it as being gynecological, but actually it impacts so much more than just gynae issues. It can impact like your whole quality of life, which can be difficult. And whilst it's a physical condition, that's not to say it doesn't impact you mentally as well. So yeah, I think there's a lot, we've got a long way to go for people to actually see it's more than just a gynae condition. And I think sometimes as well, when people are referred back to gynae, like if they've had a hysterectomy, and then they're referred back to gynecology, then gynae are saying, oh, well, you don't have lady parts anymore, so you're not our problem anymore. Which, where are people supposed to go? They're, they deserve to be seen. And having spoken to one of the Scottish specialists about this recently, his view was that they should be seen by gynae, but that isn't consistent across the board. So yeah, it's a difficult one.
Are they given much training in endometriosis, do you know?
In terms of doctors, they
Doctors and
have,
gynae.
so there is now, let me work it out. There's a menstrual wellbeing toolkit, which was established by the Royal College of General Practitioners, I believe, which is only like a half an hour long course, basically. In terms of other training, I couldn't specifically say, but I always kind of recommend to members that if they're going to the doctor, that they look up like their surgery, their surgery's website, to see which GPs have like a Royal College of OBS and gynae qualification, because I feel like at least they might have an awareness of endometriosis. which might then make that easier. That's not to say that is always going to be the case though. But yeah, I'm not 100% sure how much training they get. I know myself, I've been asked by the University of St Andrews, I've spoken to medical students twice during lockdown. So I've been beamed into their classroom to speak to them about endo in my experience. And I find that's quite refreshing that at least they're reaching out to local support and asking someone with lived experience to come and share their story. But again, not consistent across the board. So yeah.
You seem to have a really, like, that part of Scotland just seems to be really active with women's health, because I know we've done, I mean, that's how we first met, was on the Red Box, wasn't it? We did a
It
Red
was,
Box.
yeah, the Red Tent, I think, or the
Yeah.
Menopause Cafe, one of the two.
Yeah, Menopause Cafe, that was it, which again is from that part of Scotland as well. There must be something in your water, or the whiskey. Perhaps that's what it is. We all need to have whiskey to get us through these conditions. Is there a typical age when it starts, or is it something that can hit you in later life, or is it once you start your periods, you're probably going to start suffering with endo if you've got it?
Okay, so I think the youngest case that's been found of endometriosis, I think, or maybe hang on, is it when periods start? I think the youngest is 8, but in terms of diagnosis times, like for a diagnosis of endometriosis in Scotland, it takes on average 8.5 years to be diagnosed. So from my own experience, like I was 11 when I started my periods, and I'd always had really bad periods. I was passing out of school. My mum worked in a school as well, so like, when I'd go to the nurse's office and be like, oh, I don't feel well, like, having a bad period, my mum would just be like, but it's just women's problems, just get on with it. And like my mum had bad periods as well. She won't mind me saying that. She isn't on the call, which is surprising. I thought she would be, but she isn't, so that's fine. Yeah, so for me, I think it's like I've lost my train of thought, but I didn't get diagnosed until I was 29. So I had 18 years for the endometriosis to grow. And when I was diagnosed, I was diagnosed provisionally via an MRI. So I'd had the MRI and they said, oh, you've got suspected endometriosis. And then basically the rush that I was being seen with suddenly just dropped because they thought it was potentially cancer. And then when the MRI showed up suspected endometriosis, it was like, yeah, it just seemed there was a halt. And when I then had my surgery to confirm my diagnosis, I got told I have stage 4, which is like severe endometriosis. So my womb and bowel are fused together. I had an endometrioma that was growing, and meaning that I was losing weight because I couldn't eat full meals anymore because I just felt so rubbish all the time. So I'd lost like 1.5 stone. So I was down to about 7 stone, like not long before surgery. And then after surgery, it was just like, okay, right, we need to manage this, and here's the treatment options. So yeah. And in terms of when it can hit, I suppose some people actually say it gets worse after having children. I haven't had children, so I obviously can't say that that's the case. But for me, I'd always had bad periods, but it started to me daily probably. I started getting really bad back pain, and that was kind of where my endo journey began.
I lost you for a bit there, Vicky, but I'm saying 18 years for a diagnosis.
Yes.
So you were saying we lost you roughly when you were saying you were stage 4.
Oh dear, that was quite a while ago. Okay.
No, and you couldn't eat, you'd gone down to 7 stone.
Yeah. So my womb and bowel are stuck together and still are stuck together. And basically my gynae just wanted to start me on different treatments. So when I'd come round from surgery, he came at me with an injection called Zoladex, which would put me into chemical menopause, because it would, quote, make his job easier for my next surgery. However, I didn't want the Zoladex. I told him no. And he was like, oh, but you'll end up with a colostomy bag then. If you don't have the Zoladex, you'll end up with a colostomy bag. And I was just like, still no. And it was my only option. And then when it got to my follow-up, so I'd come to terms with going on the injections by the time my follow-up came. And then in my follow-up, he says, oh, we can put you on the pill, we can go with the coil, you can go on the injections, you can do this, you can do that. And I thought, well, if I'd listened to you 6 weeks ago, I would have gone into chemical menopause, not knowing what I was going to do to my body. And yet, you know, I didn't choose to do that. I did end up on chemical menopause a couple of months later, because I went on the combined pill to start with, which I'd been on when I was younger, but it just made everything worse. Like I was bleeding nonstop. What else happened? So bleeding nonstop. We lost my granddad suddenly, which you know, that was hard to take because I was very close to my grandparents. And my in-laws came up that Christmas and they haven't been back since, for Christmas anyway, because it was such a, like, it was just awful. Like I couldn't eat. I had like half a bowl of soup, which anyone who knows me, I like my food. And that wasn't me at all, but I was just like sitting in a corner sobbing because I just felt so rubbish. So yeah, no, that was that. So yeah, basically I did go on chemical menopause. It gave me my quality of life back, and I didn't get offered HRT at any point during that time. And then since then I've been on the mini pill. So I've been on the mini pill 3 years now, and I don't have periods with that either, up until recently when I had my COVID vaccination and suddenly I'm bleeding again. And it's like, oh, that was an unexpected side effect. So yeah.
Well, that's interesting because I've been reading that COVID makes women stop their periods for a while. So you're the reverse.
Yeah, I'm just unusual. That's what it is. Setting the way in Dundee. That's what I'm doing.
So is that your treatment for the rest of your life, or what's the next stage they can do? Or is
So
there anything you want them to do?
I'm actually on the waiting list for surgery, but not at the same hospital where I had my diagnostic laparoscopy. So I'm now on the waiting list for Aberdeen, which is one of the specialist centres. So there's only 3 specialist centres in Scotland. So there's Aberdeen, Edinburgh and Glasgow. So yeah, I'm on the waiting list for surgery. My symptoms started coming back probably about April time last year, and I thought I wanted to get ahead of the curve. And whilst it wasn't impacting me daily, I didn't want to get to the point where it was impacting me daily again. So I went to the doctors. She tried to take like a swab, and that was too painful, so she had to stop. And then she was like, oh, well, that's understandable. And I'm like, oh, why is that? And she said, oh, because you have rectovaginal endometriosis. And I'm like, never actually been told that. I've read books about it and never actually been told that applied to me. So that's when your rectum and vagina are joined together, and is one of the most painful types of endometriosis. So that's something that I do have. So the plan is that I'm going to have excision surgery, so where they're going to cut out the endometriosis. And unexpectedly, so I had my gynae appointment in October last year. So I had the GP in April, had teleconsultation with gynae in October, and I thought I was going to have a bit of a fight to get them to put me on the surgery waiting list because my treatment's still working for me in the main. But they actually said, they agreed with me and said, yeah, we'll put you on surgery waiting list. So I'm on the waiting list. And then earlier this year, I got asked to go for my pre-op assessment, which kind of came out of the blue. So I had my pre-op assessment in June, at which point I was told, oh, surgery might be this summer. And I was like, pardon? Because that wasn't even on my radar at all. Like I was not expecting that. And when I had my pre-op assessment, got told still, oh, it could be June or July. And I'm like, kind of need a bit of warning, but still nothing from gynae in terms of when it's likely to be. Then found out via the news that the hospital that I'm being treated at has stopped all elective surgeries. So I was like, okay, well, the hospital haven't contacted me, but it's in the news that that's the case. So it's like, right, that's fine, I won't bother them. And then I got asked at work this week, oh, when surgery likely to be? And I said, I still don't know. So I phoned today and I got told they don't have any confirmed lists for August and September, but chances are mine will be as early as September, but could be October, which if it's October, I'm kind of following a wee theme because I had surgery in October 2015, I had surgery October 2017. So it's like, you know, October is coming. So I think it'll be October. That's my guess. But yeah, that's news to my group members who are on the call, because I haven't really shared that they know I'm on the waiting list, but yeah, I wasn't expecting it to come around so quickly.
Yeah, that is quick. It's a bit like, ooh. Yeah. You said
Yeah.
you were diagnosed when you had stage 4. So what are the different stages, and does it work its way through that? Do you start with like stage 1 and then move on to stage 2, stage 3, etc.? So what are the different stages?
Right, let me get this right. So there is minimal, minimal, mild, and moderate and severe. So I always get the order of those mixed up, but I think that's right. So it doesn't always go from one to the other, but it might do. But what I should say is, if you have minimal endometriosis, you could have as much pain as someone who has severe endometriosis, because the pain doesn't necessarily correlate with the stage of the endo. Sometimes I think doctors downplay it and say, oh, well, if it's like an earlier stage, so if it's stage 1 or 2, it's not going to be as bad. It's maybe easier to treat, perhaps, like in terms of cutting it out. But there's different ways of treating it as well. So like you can get ablation surgery, which is when it's burned rather than cut out. Excision is like the gold standard, that what you should be getting. So because mine is so severe, I'll be getting mine cut out, but I only found that out at my pre-op assessment. Like gynae didn't really go through it with me in terms of what their plan was. But according to my pre-op assessment and the team that I met then, they've said that I'm getting excision of my rectovaginal disease and I'm getting excision of my endometrioma. So that's like my chocolate cyst that's on my left-hand side, because my left-hand side tends to be where most of my pain is. I was quite surprised to hear that they're only having 2 laparoscopic surgeons. I thought there would be a bowel surgeon there, and that was part of the reason why I wanted to go to Aberdeen, because they have a multidisciplinary team. So because my womb and bowel are fused together, there's more risk that they might nick my bowel. So then obviously the chance of colostomy bag or stoma bag is more likely. However, I've been told that the doctor will be on call, which, you know, should reassure me. However, maybe doesn't reassure me as much as what they anticipated it doing so. But I'm not going to lie, like I have my worries about surgery, because last time I suppose I was a little bit naive, I suppose, because I didn't know that much about it. I'd only heard of it after my MRI. I didn't have as much knowledge about it as what I do now. I didn't have a support group to keep in charge of when I'm recovering like I do now. And so from that point of view, you know, I have had wobbles where I'm like, should I have the surgery? Should I not have the surgery? It might not make things better. It might make things worse. And I suppose these are things that like members will ask me about, but like when it's me, it's different because it's me. So yeah, I feel like, you know, me sharing that is like me making myself vulnerable because, you know, normally I suppose when I'm having a wobble, I just keep that to myself. I don't necessarily go and share it. And now I'm sharing it on the internet. So there we go. I'm human.
You're allowed to share wobbles. Speaking of sharing, this must be really hard on your partner as well. Like anybody who's suffering that much, it must be really difficult for your husband.
Mm-hmm. Yeah. So for him, I would say before I got diagnosed, he was getting woken up 4 o'clock every morning because I needed painkillers and I needed a hot water bottle. So you could basically set an alarm clock by it. My body would just wake up and it's like, right, time for some painkillers, time for a hot water bottle. So he would go and get it. Mainly because my endo affects my legs as well. So like because my back is impacted by it, when I'm having like a really bad flare, which I'm lucky that I don't have them all the time anymore, touch wood. I used to, so I would try to get up out of bed and I'd just fall. And so it got to the point where he would just go and get me painkillers and a hot water bottle. But in terms of like setting up the group and stuff, you know, he's part of that as well. He's come along to meetings before. And I have to say, my mum and dad, like my mum and me have always been quite open about periods. Like, you know, that's just what we talk about. My dad used to go and buy products for me. Like, I think I was quite lucky in that respect, that when I was like, well, we're talking 20 years ago, I would give him the packaging of what I wanted, and then he would just go and buy it, no questions asked. He's also come along to meetings. So like my mom and dad came along to a meeting last year pre-COVID. He made a big song and dance because we were in a cafe, and he like threw the door open and was like, I'm here, and demanded the biggest bit of cake in the cafe because, you know, he's a bit of a comedian. He likes to put it on a bit. And he just sat down and talked to us about it. And like one of the girls will quite often say, I was speaking about piles when your dad was there. And I'm like, it's okay. He's heard worse. Like he's heard me and my mum talk about whatever. I think for him, he finds it hard when, like, if I'm really upset, like if I'm having a flare and really upset, I think sometimes he doesn't know what to say. He doesn't know what to do. And there was one day, like, I think when lockdown had eased and we were allowed to go into each other's houses again, I just needed to cry. So like I just cried to my mum for a while, and my dad was in the room as well. And she was like going to me later going, I don't think he knew what to do. Because at the end of the day, you know, it impacts them too. They like, essentially, I might not be able to have children. I'm an only child. And so, you know, they might not have grandchildren, or, well, they might not have grandchildren in the normal way. And I carry a huge amount of guilt with me about that. I know I shouldn't. And my mum and dad are both very like, they're very supportive, and they will say, you know, we don't care as long as you're okay. But sometimes it's like, it's in here, because I expected that I would be able to have children, and I don't know if I can.
That's understandable, isn't it? Because you're grieving for a possibility that may be taken away from you. And like anything, what women do is, it's how much does that hurt and upset the people around me? So you naturally then look to want to comfort those people as well. Whereas your parents are probably, you know, they're speaking from the heart when they say, as long as you're all right, we're fine with that, you know.
Mm-hmm.
They're going, it's just normal. Um, your mum had bad periods, and has she been checked for endo? And is it something that can run in families that way?
So with endo, the cause of it's unknown. There's quite a lot of theories about what causes it, but there's no confirmed, like, sort of cause, I suppose. There's also no cure, no known cure to the condition either. So it's a condition you need to manage throughout your life, basically. In terms of whether my mum has it, not as far as we know, but there isn't really a easy way of checking for it. So there was like, I can't remember if it was last year or the year before, there was like a news release where it was like, oh, there's a blood test coming out to check for endometriosis. And that's like, there's research being done, and like Endo UK totally welcome research being done, as do group members. But the only the only way it can sort of be confirmed is via diagnostic laparoscopy. So even though my MRI had shown up suspected endometriosis, I still had to have surgery to confirm it. But I think the downside of that is that, you know, if you're having a surgery for diagnostic, and then you're having a surgery to like deal with it, and then potentially have another surgeries further on, you're just building up more and more scar tissue. And endometriosis sticks together. And so it's then like, you know, that's why everything fuses together, because you've got scar tissue and you've got adhesions and you've got the endo itself. So for me, like I've had two abdominal surgeries. One that was to remove my appendix, although when I had my appendix removed, I then got told, oh, you had a healthy appendix, but we removed it anyway. But they didn't scan me beforehand either. So that's the other part. And then only recently, like obviously I had my diagnostic laparoscopy in 2017. But when I got my notes recently from NHS Tayside. And there was a letter about my surgery in 2015, which was done at a different hospital. And it said that there was like remnants of a birth cyst, which I knew about. There was also, straw-coloured fluid. And then they'd nicked my bowel as well. But there was also mention of a few different things. But they kept me in hospital 4 days for an appendix that was healthy. And then the next day, they kept coming up with different things that were wrong with me, but endometriosis was never mentioned. One day they tested me for diabetes, having just given me tea and biscuits. And obviously my sugar levels were high. And so I was like, they're going, oh, you might have diabetes. And I'm like, apart from the fact you've just given me tea and biscuits, I'm no doctor, but I'm not falling for that at all. And then the next day it was like, oh, it might be something to do with your kidneys. And I was just like, you know what? I'm just going home. Like, I've had enough of this. What's actually wrong with her? We don't really know. And I did put a complaint into the NHS about it. And that was how I found out about the bowel being nicked. But in terms of that, I do now wonder whether the bowel being nicked during that surgery has actually what's caused my womb and bowel to fuse together. And then obviously that's making my endo, the endo was probably always there. Like, there was always that question now, but I'm never going to know that. I'm never going to be able to say, yeah, the endometriosis was there, but was missed. But yeah, that was a very long-winded answer, but relevant, I think.
No, very, very relevant. Yeah, no, it was very good. So are there any warning signs that people can look out for, or is it really just a gradual build-up of symptoms?
I would say one of the things that I would recommend to members is keeping like a pain and symptoms diary. So even if you think a symptom isn't relevant, keep a note of it and then go armed with that to your doctor. Like I said before, looking up who has a gynae-related qualification as well would be useful. I think quite a lot of young people, young girls, so like when I was younger, I went to the doctor about my periods. I got given mefenamic acid from a young age. And then like when I went on the pill, when I started going out with my now husband, I started to get like constipation quite regularly. And then it turned out, I'd asked them to change the pill. So I tried a different one. It made my skin break out. Then they put me back on the one that caused constipation again. And funnily enough, it caused constipation again. And then it was onto a different pill which stopped my periods. But then soon after that, that was when I needed my appendix out. So there was all these various things, but I would say like sometimes we need to advocate for ourselves. And I probably didn't do enough of that when I was younger. I'm very good now at looking back thinking, well, why didn't I ask more questions? Or why didn't like my mum and dad ask more questions, for example? But as far as we were all aware, what I was going through was normal. Like, there was nothing to suggest it wasn't normal. At school, we were never told anything about endo, polycystic ovaries, PMDD, none of that. But yet you get taught how to like put a condom on a banana. So you know how to do that, but you don't know what is and isn't a normal period. Like, I don't get it. And that's still a real bugbear of mine because it's not, menstrual wellbeing isn't compulsory on the curriculum in Scotland or Wales or Northern Ireland, but it is in England. So it's like it shouldn't matter what your postcode is as to whether you get taught about menstrual wellbeing at school.
Or whether you get free HRT as well.
Or that.
Exactly the
Exactly.
same, yes. For women's health, I think we need a joined up UK policy, definitely, because you're absolutely right. It's mad that some people are getting taught one thing, some people are getting taught another about their health, and yeah, because especially with women, it means that women are suffering. So as simple as that. Definitely. You're in charge of the Dundee support group. So if people think they've got endo, are they welcome to go and join support groups? What exactly does Endometriosis UK do, and how do the support groups run?
Okay, so Endo UK have a number of support groups across the UK. I'm not exactly sure how many we're sitting at now, which is probably quite bad that I don't know that figure off the top of my head. But we now have 7 groups. I know, I'm off.
Yeah.
We now have 7 support groups in Scotland. So when I first started, there was only 3 support groups. There was Glasgow, Edinburgh, and Fife. So I actually started going to the Fife group in 2018. So just not long after I got diagnosed. But I made a 100-mile round trip to go to meetings, to be in a room with women who got it. And so when people say to me now, oh, I can't travel that far, I'm like, really? Can't you though? Because I've been there, I've done that. But yeah, when I met the Fife support group leader, she was very, like, we got on really well, and she was very encouraging and basically had suggested that we needed a group in Dundee. So I think I went to maybe 2 or 3 of her meetings, and then I basically applied. Well, I'd asked Endo UK if they'd set up a Dundee group, and they said yes. And then I had to apply to be support group leader, at which point I was working in HR, working full time, and they thought that I would be a good fit because of that, because I have the sort of endo as an individual with endo, but also managing people's sickness absence who potentially have endo. I remember a sickness absence meeting I was sitting in before, like, most people knew I had it. And the person was going, I have endometriosis and you don't get what it's like. And I was sitting like, I need to be professional. I can't sit here and go, well, actually, yes, I do. And this is what you can do about it. But in terms of Endo UK, what they do is they have like a few different support networks, basically. So there's the support network with the support groups people can attend. So currently they're all being done online because of COVID. So previously we would have face-to-face meetings once a month, and then they all had to move online because of COVID. And then what else do they have? They have the helpline. So there's helpline volunteers as well. And they also have a forum on the Health Unlocked website, which is actually what I used when I was first diagnosed. So I used that and the Fife group. And they also have, like, basically they have a lot of information on their website. So it's a good information resource. Like, the amount of times that I'm linking things to the group where I'm like, oh, okay, you think you have endo on your bowel, right? Here's a fact sheet about that. Or you don't know what treatment options to have. Here's the information pack. Or you're thinking of having a hysterectomy. There's an information pack for that. So there's quite a lot of resources that we can direct people to. And I think the thing to remember is that we are not medical professionals, we're volunteers. And I think sometimes people forget that and expect us to be like on call all the time. And I'm sure, like, you guys possibly get the same with your Know Your Menopause campaign, that people just expect you to be on the end of a message all the time, and that's not always going to be the case. So yeah, that's basically what Endo UK can offer. And yeah, like I was saying about the support groups, so there's 7 support groups now in Scotland. So we have a much wider covering than what we did before. So we have, there's now Scottish Borders, we have Glasgow, Edinburgh, Fife, Aberdeen now have a group, Dundee obviously has a group, and there's Caithness and Sutherland, and there's one other, is there? Hang on. Dundee, Aberdeen. No, that is them all. So we have one right up at the very top. So it's actually the North Highlands group now. It's recently changed name. So yeah, we're getting more awareness in Scotland, and I'm also on the Scottish Government's Endometriosis Collaborative Forum. So they've got like a few of us support group leaders, but also independent groups and patient representatives, with the plan being that there's like an endometriosis action plan, and we're having input into that as to what is and isn't feasible.
That's really cool. What would you like to, apart from just education at school, what would you like to see change? What improvements would you like to see?
Well, so people who have been on a support group meeting will have heard me say this before, but in terms of diagnosis times, like, education obviously a big thing, but also Nicola Sturgeon has put in her manifesto that the plan is that diagnosis times will be down to less than a year by the end of this parliamentary term. Given diagnosis times haven't changed in the last decade when the SNP have been in power, I just kind of wonder how realistic that is And then when you have specialists who are saying, we don't know what causes it necessarily yet, and we don't know what the cure is, but there's treatments being looked at. I think for me, it's about moving on the research that's being done. And I've certainly heard a lot recently of like people doing dissertations on endometriosis. So, you know, from that point of view, there's going to be lots and lots of data, but it's like, what are we actually going to do with that data? And how do we make that data like practical, I suppose? How do we put it into practice of what's come out of that? How do we put what needs to be done into practice? And I think also like the clinical trials that are being done, I think need to be rolled out wider than just one NHS area. So for me, it's like, you know, if a group member says, why can't I be on this clinical trial? And it's like, because we don't live in the right postcode area. Like, you know, it's not good enough. It should be a case of we should all have the equality of opportunity, but we don't currently as it stands. And that's not to say that won't change, but I would like to see it change.
I love that phrase, equality of opportunity. I'm going to tweet about that as soon as we're done, because you're spot on. That is absolutely spot on. We should all have that equality of opportunity to be able to get on the trials and do it. While you were speaking, it just made me think like how far we've come with breast cancer awareness. And yet, once you get below the waist, there's nothing, you know what I mean? Because let's face it, vaginas and vulvas aren't really pretty, like men's bits aren't pretty either. So people don't want to see them. Whereas if you got nice boobs, everybody's like, oh yeah, breast cancer. And perhaps we need to have like the equivalent of moonwalks for menstruation and for endometriosis and menopause, and get fanny heft or something.
I'm totally up for that. That would be fabulous. But we do endo marches. So like when we were allowed to do face-to-face ones, I did go to the one in Glasgow last year, which was my first endo march. And like we were going around the streets of Glasgow chanting, what do we want? An end to endo, when do we want it now? But also things like supercalifragilistic endometriosis, even though the sound of it is something quite atrocious. So, you know, we came up with things that we could use. There are other ones, but I can't remember any of them just now on the hop. But, you know, I think just being with people who get it is really important. And I think sometimes people on the groups and stuff don't come along to meetings. They just want to be in the background. And that's fine. But sometimes I think it's about trying to get them through that door to like come to a support group meeting and see the benefit of coming to a support group meeting. Because I can wax lyrical about, oh, you know, it's really good and this is why you should do it. But I think at the end of the day, it needs group members to say, this is why I go, this is what I get out of it. And this is what you could get out of it. But you know, people need to be in that position to be ready to try it. But I would say going online to start with, we didn't have many numbers, but then we started to get more numbers. So we had like a focus group earlier this year to ask group members what they wanted from the group. So since then, we've had a few different group-led discussions. So we had one on mindfulness and meditation, we had one on hysterectomy, and then most recently we had one on adenomyosis and endometriosis. Which, you know, that format seems to work for our group. I'm not saying that would necessarily work for every group, but it's quite nice actually me just being able to sit as a participant rather than as a facilitator sometimes as well, because at the end of the day I live with the condition too. So
And adenomyosis is
oh now you're asking. Adenomyosis is right, I'm gonna get this totally wrong. Basically it's when the womb gets bigger, and cells in the womb get stuck. I don't know. That is terrible. I should know that, and I don't.
That's fine for me. It's something to do with your womb and the cells. That's all I need to know. It's got me through.
It's something to do with your womb, and it turns out that I also have that as well. But again, I didn't get told that. I found that in my medical notes. When I got them. So my MRI showed up, I have focal adenomyosis, but no one's ever actually told me. But it does seem to be a common theme that if you go private, you get told you have adenomyosis. If you get your medical notes, you get told you have adenomyosis. But if you go to an NHS gynae, you get told nothing.
Yeah.
So I just googled that,
Thank you.
and the official Google Wikipedia, the growth of cells that build up inside of the uterus, atypically located within the cells that put up the uterine wall. So it's a thickening of the wall of the uterus, which then, of course, has a knock-on effect to everything else in the womb.
Thank you, Lynn.
Thank you very
You
much.
got my back.
I wish it's great. I find you so inspiring because you live with what sounds like a horrendous condition, and yet every time I see you, you are so supportive of other women and so helpful. And I'm always blown away by how positive you are when I'm having menopause days and I'm sitting there in a corner going, oh God, I just want to kill everybody and show the world. But yes, no, I think you're so inspiring. It's brilliant. Do we have any questions, Claire?
Oh, you're on mute.
Mute. Ah, yes, we do have one that I can really, really relate to. It's a message that said, I had a hysterectomy 2.5 years ago, leaving the ovaries. I was told endometriosis was stuck to the bowel and the bladder after surgery. I don't know if that was found during surgery or it happened after surgery, but stuck to bowel and bladder after surgery. Never knew I had it. Had heavy periods and lots of pain, suffered deep pelvic pain. Just hold on a minute, I've just got a message here. I just want to check that out. Found deep pelvic pain and stiffness ever since, and pain right under my bottom area, which is always there. Awaiting a gynecological appointment. Could this be endometriosis?
Ooh.
Question 1. And can it be diagnosed on an MRI? Question 2. Or would I need a laparoscopy?
Okay, so like I said before, not a medical professional, but potentially, yes, it could be endometriosis. I would certainly be looking at like the fact sheets that are available on Endo UK's website and seeing whether your symptoms match up. So like endo on the bowel, endo in the bladder, I would definitely be looking at those to see whether you can sort of tick them off and be like, yeah, that is what it could be. And then I would take them with you to the doctor to say, this is what it is. In terms of whether it can be diagnosed via an MRI, mine was sort of suspected endometriosis on an MRI. And I got told I had like cysts. And that was all I was told. But then obviously, like I just said about the adenomyosis, that was picked up on my MRI, but I wasn't told. But you would still potentially have to have surgery, but you would probably still have to have surgery to confirm that it's endometriosis, like I did basically, because even though mine was suspected, I still had to be cut open to confirm the diagnosis and to, I suppose, tell me what the stage was, but that isn't always the case. So depending on what gynae you get, some gynaes will tell you the stage, some gynaes won't, and some just refer to the term, so like mild, minimal, mild, moderate and severe, rather than stage 1, 2, 3 and 4. So yeah, that would be my advice. Probably looking at the resources. I can pop them in the chat or share them with Claire and Liz after the session if that would be helpful. But yeah, and I would say like even if you wanted to have a chat before your gynae appointment, I'm more than happy to like have a chat with you one-to-one or whatever is totally fine. Just drop me a message and we can arrange that as well if that would help.
That's great. And when you refer to surgery, Vicky, are you thinking laparoscopy?
Yes, so in most cases it's usually a diagnostic laparoscopy, but then obviously depending on what they find, then it might need to be I suppose converted, don't know if that's the right word, converted to like open surgery. But in most cases it would be done laparoscopy. I can't say that word. My husband laughs at me. It's like I can say laparoscopy quite easily, but then when you try and like do some sort of adjustment on that word, it's like my brain just goes no, like brain fog. No, thank you. Yeah, so that would be my thought.
Isn't it?
Thank you.
isn't it
You're welcome.
appalling that endometriosis is the second most common gynecological issue for women, and yet there is so little knowledge about it for women to even know if what's happening to them could possibly be endometriosis. And that's where that education comes in. But I just think second most common, this is just disgraceful.
It is, and I think, you know, you only have to look at, it's not only my experience, like if you look at other support group leaders' experiences as well, like we've all waited a ridiculous amount of time to get that diagnosis. I think for me, like I still count myself as being quite lucky, which may sound totally stupid, but because it wasn't impacting me daily until like 2017, I had a fairly short diagnosis time from that point of view, because I got, well, basically my cancer markers were high. That was where it started. So I went to the doctor, I had urine samples done, I had an infection. So it was like, right, here's some tablets. Went to see a different doctor. They wanted to put me for scans, but then my symptoms alleviated. So then I didn't go for scans. And then it wasn't until I seen one doctor and she said, you know, have you had your cancer markers checked? And I was like, I don't know. I'm like, I had blood tests, but I don't know what was checked. And then I got told my cancer markers were high. So she did the test one day. I got a phone call the next day to say, your test results are back, but the doctor can't speak to you for 24 hours. So I had 24 hours going, shit, I could have cancer. And then it then turned out, you know, like I say, I got seen fairly quickly. I had scans done, I think probably a week later. I then seen gynae, I think the week after that. And then I had my MRI a couple of weeks after that. And so in terms of all that, all happened very, very quickly. But then when it was suspected endometriosis, it was like, yeah, okay, you just need to wait to see the specialist now. And the funny thing is at Dundee, the specialist isn't even like a specialist. He has a specialist interest, but he's not a specialist. Like he's not a specialist that's like in one of the specialist centres. It's a different level of specialism. And so when I actually did see him, the day I got admitted to the gynae assessment unit, and he had a cancellation that day, and I was like, well, I'm here, I'll just have that appointment, thanks very much. And they basically said, no, you can't do that. And I was just like, well, you can go and try and phone people, but the chances are they're not going to be able to come, so I'll be having the appointment, thank you. So I did get the appointment, and I got put on his waiting list at that point. But he likes to speak to my husband rather than speaking to me. So there was one day we were in an appointment, and I'd asked the question of, you know, if I tried to fall pregnant, would it put me in danger because my womb and bowel are stuck together? And he was like, I don't actually know. And then he drew me a picture of my womb. So he's then like going to my husband, going, your womb, and like pointing. And my husband was like, And then he just kind of, my husband now doesn't look at him in the eye because it's just awkward, because he's like, I don't have a womb. And I'm always like, hello, like if anyone in the room has a womb, it's me. But it's, you know, why are gynecologists so, you know, they don't feel comfortable speaking to women about their bits, but that like, you know, you go inside and they're like, yep, okay, this is what it is. But when it actually comes to the people skills, it's rubbish. And yeah, now I'm just going on a rant about my gynae, but yeah, I found out the other day he's no longer there, so that's a win. So, you know, I feel better knowing that.
Let me unmute myself again. Lynn, you have something you'd like to share with us, I think.
Okay, well, I'm one of Vicky's minions in her group. I think I found Vicky maybe about 18 months ago online, purely one of those nights in pain when you're Googling away and don't know what to do with yourself. So I've got a wee bit of a similar story way back sort of around about the 14, 15 age group. I was having those crazy periods where you're collapsing at school and you can't sit down and things like that, and was just told, oh, it's just women's problem, and got put on the pill. I was on the pill for about 15 years and never had periods and thoroughly enjoyed myself. So it was great. and then decided I wanted to have children. So came off the pill and basically had horrendous periods again, struggled to conceive, couldn't work out what was going on, was having lots of tests. They kept finding loads of free fluids knocking around inside of me on scans, couldn't work out what it was. I had like my tubes flushed, which was deeply unpleasant. I wouldn't recommend it to anyone. And it was just, just this kind of, we can't really work out what's wrong with you. But in fact, I think at one point I was told I must have an inhospitable womb, which is great. So finally sort of worked things out myself, and that I had a very, very long cycle, that I only had like 8 periods a year. And when they did come, they were mammoth. But I fell pregnant with my son, which was great. I had one of those pregnancies where I couldn't get my head out the toilet for 9 months. So I actually lost 10 kilos in my pregnancy. When I went to have my son, my cervix never ever dilated past 2 centimeters. And I was a little bit freaked out by this, and because it was just, and they were giving me all the dilation stuff. No, nothing was happening. Every time they went to sweep on me or do any kind of examination, the pain was excruciating. Like they had to pretty much knock me out with Entonox every time. So eventually, after 3 days of labour, they took me for a C-section, and I'm a nurse. The person who actually did my C-section, I know her, I worked with her. She did surgery on patients I look after as well. And I trusted her implicitly. And she said that basically when she got in there was quite a lot of adhesions. She couldn't work out why. But I ended up with a paralytic itis after my C-section, and was, virtually on the verge of going back to theatre 5 days later. When they gave me a drug that I was allergic to. So I had a massive anaphylaxis and resolved my own paralytic ileus. So yeah, that solved that problem. So that was a little bit traumatic, as you can imagine. Of course, after having baby and stuff, everything's crazy period-wise, and actually it took a wee while for things to settle down. 2 years later, I had another baby, very similar pregnancy, lost loads and loads of weight again. Tried to have my daughter, and actually I conceived that one. It only took a year more than anticipated to conceive her. We seemed to get it better that time. Tried to have her naturally. Again, cervix never ever dilated past 2 centimeters. So I don't know if that's something that just my cervix just doesn't want to play ball. And got taken in for surgery again. By this point, we'd realised that I'm allergic to opioids, hence the anaphylaxis last time. And so I'm a nightmare to give a general anaesthetic to. So they were trying to manage me on just a spinal block, and basically I felt everything. So they had to GA me. And when I wakened up, I had a baby, obviously, but I also had what the surgeon referred to as a newly fashioned bladder. And I thought, oh, this is interesting. Basically, when she'd opened me up, my previous C-section scar, my bladder was completely adhered to it. So first pregnancy C-section, they found adhesions in my bowel. Second pregnancy C-section, they found adhesions in my bladder. Nobody seemed to think this was a thing, and we fixed it now. It's fine, we'll just move on. After my daughter, when my periods came back, they were utterly horrendous. I couldn't stand, I couldn't sit, I couldn't wear a tampon. The pain was excruciating. And I'd get through, like, those pads that they say last for 9 hours, 8-9 hours overnight. No, 45 minutes for me, and then I was right through them. It was just awful. So went back to the GP, and who was just like, get you right back on that pill, because you're just going to end up anemic as hell. So I went back onto the pill, and actually things settled. Of course, periods just stopped and kind of cracked on okay. Had a weird ovarian cyst one day at work, just popped this weird ovarian cyst, and like really bad pain, just a spontaneous rupture of it. And they did do an external ultrasound scan. They went, oh, it's lots of free fluid, but it's moving away itself. You'll be fine. Gave me some antibiotics, pain relief, sent me on my way. And then around about maybe 2 years later, I popped another one in the middle of a kickboxing class, which was hilarious. Popped this, and this was a very clear pop. I could feel it, and I thought, that's another ovarian cyst I've just popped. And then the pain was just lingering for days and days and days. Then I started passing this horrible, what the only words I've got for it is brown rusty water. Went to the GP, because I was starting to get a temperature and stuff by this point. And she took one look at me and she went, and she got out her speculum and she's like, I want to have a look inside. And she went, your whole cavity is just full of this brown rusty water stuff. So I was just full of this weird infected ascites, obviously on the back of what had been ovarian cysts that I didn't know were there, but were popping on and off. Got sent up to Ningwells Hospital for a scan. Very luckily, I walked into the radiology department and a friend of mine was on scans, and she's like, right in now. She did a very long internal scan on me and pointed out all my endometriosis to me. And I kind of lay there going, oh hell, okay, this is major. And she's like, right, I'm going to refer you into gynae. So it took another 8 months till I saw a gynecologist. And he was like, and it was the same delightful man that Vicky's been talking about. Basically, he was like, well, that's fine. I'll operate. I'll take all of them out and I'll put a coil in. And I went, okay. And he wanted me to have the Mirena coil. He said, but actually, in the meantime, I'd like you to have a Mirena coil put in at the GP so they'll shrink. And I'm like, okay. So organised to go to the GP. This was hilariously funny. The poor practice nurse, who I do know on a personal level as well, she was like, yeah, I'll get your coil in, no problem. Of course, I've got a cervix that doesn't open. So she was like, she says, your cervix is like a pinhead. I can't do anything with that. As soon as she touched it, I went into cervical shock, had a major hemorrhage and passed out. So yeah, I'm not going to be having one of them. So that didn't happen. So I got put back on the pill to try and sort of manage the bleeding, which was 3 weeks on, 1 week off. So all great plans had to be made in the week off. And it was just horrendous. The pain, the bloating, the weight gain, the brain fog, the just back pain, hip pain, generally not sleeping is one of my biggest issues. So I'm still waiting for that laparoscopy that I was promised back then. I've spoken to my GP since, who has actually re-referred me back in an emergency, saying she needs a hysterectomy now. And that was May. I have a telephone appointment in 2 weeks.
God, this is just what gets me. It's just shocking how bad it is. Thank you so much for sharing, and I hope your telephone appointment goes well.
Mm-hmm.
Yeah,
So do
absolutely. Thank you so much for sharing, because I know that people who are going to watch this at a later date, and we do upload all these sessions up onto YouTube, and well, I'll share the YouTube channel with you when it's uploaded. Do share this with other people as well, because the stories that we're hearing, and it takes me back to I know I thought I had a bad time with endometriosis and it took 7 years to be diagnosed, but bow down to you guys. This is this is really serious. Mine actually ended up with a full hysterectomy because I was attached to my ovaries and bowel, and I love the phrase shitty bum pain. My God, I remember that shitty bum pain. Because I was also at that time going through an early menopause as well. So the answer was, well, if you're going through an early menopause, you might as well have a full menopause and have a full hysterectomy at the same time. But I am going back 30 odd years. So there wasn't it's good now I'm listening to you, Vicky. It is good to hear that there is more research and there's definitely support groups And bear in mind, mine was before Dr. Google as well, so support groups wouldn't been an option, and that people are considering how it can be treated. So, you know, that is a real positive to hear, even though for those of you that are struggling, it can be a shitty bum pain time, and all the rest that's thrown in. So thank you so much, Vicky. Thank you for everyone who shared their story. This is our last Positive Living. Oh, we're not going to cry. This is our last Positive Living, certainly for the summer. We started last October thinking, oh, we'll do one a week for 6 weeks for World Menopause Day. And we currently have over 40, nearly 45 videos uploaded.
Something like that, yeah.
It's something like that. So, you know, we are having a break, and the Pausitivity creative director, aka Liz, will no doubt come up with some other bright idea to keep us going for this World Menopause Day. But we are still campaigning to get the poster seen in every GP surgery. We seem to be getting it in so many workplaces now, which gives us great joy because people share that with us. So that's magnificent. We've got some exciting things coming up with regard to menopause, haven't we, Liz, with getting it. People in high places are getting involved. So we're very grateful that, you know, they're listening to us as well, and the need for greater awareness. Yeah, so it just leaves us really to say thank you so much again. Goodbye to everybody who's taken part, to those that will be listening at some other time. And hopefully we will meet up with you again sometime in the future. I'll certainly email when, if and when we do that. So have a great summer, and it's goodbye from me, and it's goodbye from her. That was, we should have practiced that for 2 honest.
Bye bye.
Bye, guys.
Thank you.
Bye.